of us have been postponing visits to the doctor because of the pandemic. Joining us now is Dr. Monica Peek, an associate professor of medicine at the University of Chicago. Good morning to you.
Thank you for having me. Good morning.
It's a pleasure to have you on. Let's talk about how many people have been not going to the doctor, not seeing their doctor in person, even though that they maybe should be. And where do we start after a year, 15 months of not being able to really see our doctor face to face? Where do we start with what we need to prioritize for our health care?
Yes. So many of us have been having the advantage of seeing their physician through telemedicine.
Yep.
And so that has been great in that we have been able to do some level of continuity of care for primary care. But many people have not been able to do the things in person, like colonoscopies or certain kinds of blood tests. And then there are many people who have stayed at home for urgent and emergent conditions.
And that's one thing that we really need to pay attention to, things that aren't necessarily life-threatening emergencies, but are still quite urgent. What are on those lists? If we've been feeling tightness, what should we be looking for?
Well, I will also say that people have had emergent situations and they've stayed at home.
Is that right?
Yes. So we have seen a national rise in the incidence of heart attacks and strokes because people have stayed at home with those symptoms. And so we've even seen people come into the hospital at the university who have suffered complications from stroke because we realized that they had a stroke at home 6 months earlier.
Oh, wow.
And now they're coming in because of aspiration pneumonia, because they haven't been able to eat properly from the stroke they had during the pandemic.
Oh,
and
wow.
So, yes. And so what we need to now be thinking about is not just the primary care needs, but to reinforce the message that the hospital has always been open for urgent and emergent care.
Yeah.
Never stop coming to the hospital when you're having chest pain or stroke-like symptoms. The pandemic is never a reason to stay away. Our doors are always open for those.
You were talking earlier about colonoscopies. That is one of those important elective surgeries that we should keep on top of. Where should we be going now? What are the important electives that we should be talking to our doctor about next week?
Okay, so we talked a bit about urgent and emergent care for elective surgeries. Within every category, there's a bit of triage. So some surgeries are more important than others. So if you have, for example, a blockage in your heart and your doctor says, you know what, we need to stent that heart blockage, but it's not going to kill you today. That is really an emergent or an urgent situation. You need to get that taken care of as soon as possible. If you're having cosmetic surgery or need a knee replacement at some point in the next year, that really is elective. So there's always a bit of triage for any condition.
One of the things that telemedicine has been very good for is mental health care.
Yes.
And that has been, I think that'll continue going on as far as telemedicine. But still, a lot of people have postponed their mental health challenges because of the pandemic.
Yes, and the pandemic has actually created a number of mental health challenges. We have really stressed the mental health community during the pandemic. And so there are many people who have chronic mental health conditions and have seen those escalate. I actually took 2 calls yesterday. I'm not on call, but 2 of my patients were contacting me because they've had an escalation in their symptoms of depression and anxiety and needed acute management yesterday. And so for people who are suffering and really need acute care, that is something that you can't delay.
These last 2, let's bundle these together. The cancer screenings and the annual checkups and the physicals, both of those things are important to do on a routine basis.
Yes, because we've also seen an uptick in rates of cancer. And so again, thinking about triaging for yourself, do you have a personal history of cancer? If so, your cancer screenings are more important than ever. If you have a history of chronic diseases like diabetes and hypertension, making sure that you're going into the doctor for that regular checkup to get your blood work to see what your cholesterol is, what your A1C is, those are more important than if you have no chronic conditions. So everyone needs to sort of get back into the doctor for all these routine things, but some people and some conditions are more important than others.
I can imagine there's going to be a glut of patients now trying to get in to see their doctor face to face. How do you kind of put your hand up in the air and say, hey, doc, maybe me first?
Well, again, we're risk stratifying based on the chronic conditions that people already have, the risk factors that people already have, how long it's been since they've been in to see the doctor. But we are open for business, and we are really excited when people are making their way back into the clinic. Yes.
We are glad that you are able to open your doors back up to patients. Dr. Peek, thanks for joining us this morning. Do appreciate it. Hey, for more information, you can check out the website myhealthcan'twait.com, myhealthcan'twait.com/Illinois for more information. Do appreciate it, Doc.